So I'm just curious your reactions and listening to Joel Ario laying out some of the options being talked about in Washington, options that range from single payer, big government, over to propping up the employer sponsored insurance, to keeping alive and expanding the affordable care, to the option of not doing anything and just letting the system work itself out. What do you think of all that?
Well, I think we're missing some key things. This is a transformative historic event, and everybody's looking at what we've always done instead of saying we are given the opportunity to think differently in this space. For example, telemedicine is going to be completely transformed. There are going to be people who wanted face-to-face doctor's appointments who've now gotten comfortable with not just the Ask a Nurse line, but let me take a picture of what my throat looks like and you tell me if I need to go in for a strep test. So faster approvals at the FDA. Are we looking at what happens when you get out of the way of innovation so that we don't have stage 1, stage 2, stage 3 trials costing hundreds of millions of dollars built into the cost of our pharmaceuticals? Are we getting better at self-care? Is this opportunity in our population to say we need to be more responsible about the choices we make? Underlying conditions are a huge factor in death in COVID cases. Our mental health. We've done more talking about mental health and how do we do it across state lines? How do we provide continuity of care? Telemedicine has obviously been a part of that. Supporting people who are going through addiction recovery in conjunction with mental health. As we're going through these really troubling times where we're separated from group therapy, we're separated from our therapists, we're doing these things. And then the importance of preventive care. If we can all take the lesson to wash our hands, go for a walk, socially distance, wear a mask, we are an educable population. And so what I hear is a lot of status quo talk and not a lot of we need to lead to the next thing. Why are we stuck in status quo talk? Because everybody wants to be comfortable. When things are unstable, leaders have to look for what's different, what's next, not in a manipulative, never let a crisis go to waste sort of way, but in a, you know what, things are going to be different. We can either help design that and move towards it, or we can fight to retain what we've always known.